Hier kann man Jahrzehnte retten und Leuten ermöglichen.
We can save decades here and increase people's life expectancy from under 50 to over 60 years. An opportunity to improve healthcare through research and science, even in the poorest parts of the world. My name's Till Bärnighausen, and I'm conducting research on how best to improve public health in Africa.
He's armed with numbers, statistics. Bärnighausen is one of the world's leading researchers on issues of global health.
We're here in a district in South Africa that is likely the poorest in the country, with the lowest life expectancy, where basic electricity and a secure water supply to local households are almost non-existent.
Field research creates facts. What is the effect of each measure? And how does health actually pay off?
We're asking the households, has someone been born or has someone passed away in your household? And has the social position of the household changed? Have you bought a television, a car, or were you given a bicycle or a telephone?
A detailed collection of data compiled over many years that when linked can answer an array of questions. And we can see medical help to the individual is help to the whole community.
We see people in their family affiliations. We know who lives with whom. We know who belongs to whom socially. And when we use this data, we see that HIV treatment has a major impact on children's success at school. A child who lives with an HIV-positive family member, who is fortunate enough to actually receive treatment, is far more likely to be successful at primary and secondary school.
Medical advancement is not confined to innovative medical procedures.
We don't discover new medications or medical techniques. However, we do discover how best to cater to the men and women in a society to ensure that their healthcare needs are met, and how these large-scale public healthcare services impact on morbidity, mortality, as well as the economic and social development of a society.
Bärnighausen's research in KwaZulu-Natal shows how HIV treatment can greatly improve the living situation. In the 8 years since starting the large-scale treatment in this region, on average the life expectancy increased by 11 years.
This is one of the quickest increases that has ever occurred over time. Similar examples only exist in Europe, with the receding of the plague. In my eyes, this is truly a strong motivation to work in Africa.
The research center is located in the middle of the research area, a Zulu settlement. Bärnighausen is conducting his research here as well as in 4 other African countries. One thing has always been clear to him. Research in such areas cannot simply be observational. It must, wherever possible, also be helpful. About 1/3 of the population in the surrounding communities of where Bärnighausen and his colleagues are collecting their data are HIV positive. Every 4th person has tuberculosis.
The main purpose of mobile clinics such as the one we see here is to provide people who live great distances from the next stationary clinic with better access to primary care.
HIV tests and medicinal supplies, valuable help on location, and valuable data for research. Work that shows which measures are effective and how governments and international funds can best apply their resources. And on the other hand, what resources may still be lacking.
How long does it take for people from the date of infection to make it into the clinic? And the answer is about 5 years.
With the Humboldt Professorship, Bärnighausen intends to expand the Center for Global Health Research in Germany. For this purpose, he went from the University of Harvard to the University of Heidelberg. He is also advisor to a UN commission and support to various countries on how to effectively fight their battle for a longer and better life in the most impoverished parts of the world.
If on my deathbed I could think to myself that I managed to influence governments on 10 to 15 occasions throughout my life to do things differently, and it resulted in the entire country benefiting, I'd be over the moon. I really think we're well on the way to doing just that.